Welcome, ladies and gentlemen, to episode 5 Beyond the Surface, a Psoriasis podcast. I'm Sophia Lowy. I'm honored to be your host today. This module will focus on challenges in managing psoriasis. We will have 4 speakers giving their insights in some of these challenges. Let's begin by calling Elissa, the Policy and Advocacy Manager of IFPA, on the findings of an Asia Pacific survey commissioned by IFPA.
Thank you, Sophia. Our studies and deliberations in recent years have revealed the key challenges facing psoriatic patients in the Asia-Pacific region as ensuring access to care, addressing and managing comorbidities, prioritizing mental health care, and combating the social and familial impact of the disease. We need to work towards early diagnosis, comprehensive treatment options, people-centered care, and mental health support to help those affected to live fulfilling lives. High cost of treatment is a daunting challenge in many parts of Asia, resulting in choices based on affordability and leading to high risk of undertreatment and avoidable patient burden. Newer treatments are available, but for economic reasons, some countries are not able to prioritize access to those medicines. Recently, the Philippines and Panama have introduced groundbreaking legislation to ensure equitable and integral treatment of psoriatic disease for their citizens. Through collective actions, we can make a difference to the lives of psoriatic patients in the Asia-Pacific region.
Malaysia participated in the study that Elissa mentioned. What are the key findings for Malaysia? Dr. Thiru, can you help enlighten us?
Thank you, Sophia. This survey was conducted sometime in 2022. And let me share with you the key findings of the survey. Firstly, the survey reported that financial burden and ineffective treatment represent the biggest challenges in treatment of psoriasis in Malaysia. And you often hear this coming out in most surveys on psoriasis, patient feedback on psoriasis. Financial impact is the one that is a common theme coming out from all these surveys. So this is a survey that was, as I told you, it was done in 2022 by a international joint survey in which a number of participants from Malaysia responded to this survey. The survey findings also revealed that 53% of respondents in Malaysia identified financial burden, which is quite a sizable number of people who responded to this in Azrul, and followed by ineffective treatment. And I remember that a third point that they mentioned was about inconvenient, unacceptable waiting time to see a healthcare provider. This is very important. It's a point that has got impact on what MOH needs to do to address some of these challenges. So there you are, financial burden, ineffective treatment, waiting time. And regarding this financial burden, 33% of the respondents indicated absence of insurance coverage as well. Again, although we very much welcome the recent statement by the Minister of Health that they were going to look into a national health financing scheme, although no details have been spelled out, but this is an area that we really need to address, and 61% of the patients revealed that they have financial burden due to treatment costs. And I can tell you the number of patients who have, many of them have given up because they didn't have the money. They couldn't access alternative kind of sources for treatment. And so they virtually went back and completely gave up treatment actually. And some of them, as I said, 21% of them responded either they've given up or they've reduced treatment or borrowed money for treatment. So you can imagine the serious implications of people who are struggling to pay the cost for this. Sophia, some of the key findings that emerged on in terms of financial burden for them, ineffective treatment, long waiting times, Azrul. So we hope that this will be picked up by the powers that be. Thank you very much.
The Galen Centre for Health and Social Policy produced a seminal report on psoriasis in 2020, the findings of which are still relevant today. I have a great pleasure in inviting Encik Azrul again to share with us the key challenges identified in that report.
Thank you, Sophia. One of the key challenges that was highlighted in this report goes back to the point that was highlighted by Dr. Thiru just now concerning the financial catastrophe for which a lot of people have to basically face the possibility of when they get diagnosed and then wanting to get treated with psoriasis. Now, a lot of people think that this being a skin condition, I mean, how honestly could you be it being so much more expensive, or what kind of treatments are there and so forth. But in reality, what you find is that we see there is a gap between what is needed versus what we are able to provide. And very often what is needed, especially when it comes to ensuring a holistic approach to the treatment of psoriasis, we are unable to provide that. And that is really because we are very much dependent on subsidized treatment and care in this country. And that means it's the public health sector. And because it's the public health sector, you have to look back at how many different types of resources are there to manage psoriasis. And you find that the number of people who are able to, you mentioned just now, a healthcare provider who can be able to diagnose, treat, and then continue monitoring that treatment for a period of time. The number of dermatologists who are able to do that in the private sector is very small. But the patient load, the number of patients, I think the estimated number that we have right now is like 500,000, 600,000 people with some form of psoriatic condition, right? So obviously they're not all going to see the doctor at the same time, but still that is a very large number. And so a lot of people will basically go to the private sector. There is a fair amount of cost there, but there is also a fair amount of frustration there in terms of the waiting period, which then results in, unfortunately, a lot of people then resorting to unconventional treatments, things like the TCM, the traditional complementary medicine. And that's where you get a lot of people spending money to then, in their mind, it's treating the disease, it's treating the condition. But what it could be is exacerbate, make it worse, the condition which they are having to face. But it's really because they can't get the appointment to see the doctor. They can't get the appointment to collect their medication or to be able to be prescribed. And so you find that they then resort to something else. And here's the kicker, Sophia. Sometimes you find that people spend more for the so-called traditional complementary medicine compared to the actual allopathic medicine, that we're talking about. Say it's 5,000 ringgit for allopathic medicine, one that you go to the private sector, collect and thing. You spend 25,000 for TCM. And somehow the calculus works, But when we look at the findings from the report that was written, you find that it's also things like patient dissatisfaction. It's also linked back to the issue just now, which I mentioned, about how people look at what the doctor says and what I need. And very often there is a gap there in terms of what is able to be provided, as I mentioned. We can't give the whole, I don't like to use the comparison with Rolls Royce, but if we wanted to say that the standard, the quality of care that we need to give versus what we can provide, sometimes what we can provide falls short, and therefore the results also fall short in terms of expectations. People expect that if I'm going to go for treatment, I'm going to get this kind of result, but it doesn't often turn out that way, because It takes time. It's a cumulative effect also sometimes. It's not acute, meaning you take the medicine today, mean in 2 days' time, you're not going to get the necessary result. It could take a week, could take even longer for you to be able to get the kind of clearing of skin, to be able to get the kind of result that you, in your mind, expect. So patients can get dissatisfied as well. And that's one of the things that we pointed out in the report. The issue is, of course, in terms of standards, in terms of treatment standards that we have. Good thing is, there is now a clinical practice guideline for psoriasis, right? That's been produced by the Ministry of Health.
Yeah.
But here's the thing, what is in the guidelines may not be necessarily what is actually practiced or provided by the healthcare provider, because you may not have the tools, you may not have the medication, you may not have the expertise to be able to carry out the CPG. So in that sense, you find that the treatment standards are irregular. There's also the issue of affordability for many of these treatments as well. Maybe patients fall short of being unable to access this treatment that we're talking about because it costs so much. And then I think it was mentioned about how you want to look at insurance, whether or not the insurance is able to cover. I think in the survey that you mentioned earlier on, there was this financial aspect of the survey, which for Malaysia is interesting. I don't know what the other countries were looking at, but this goes back to how much medicine can one afford, really? And here's the problem, at what point do you give up? Like if the cost of treating yourself costs in the hundreds of thousands, maybe it doesn't cost that much, but say if it's like 50, 60,000, you're going to think and decide, if I'm going to sacrifice my kids' education to get myself treated, if I'm going to sacrifice having a home over my head or being able to ensure that I'm able to feed my family, I can tell you, the decision that people often make is that I will forego treatment for myself to make sure that it doesn't jeopardize other people. And that's a tragedy that a lot of people, not just with psoriasis, but other chronic conditions as well, are having to make these tough decisions. It's between treating myself or causing harm or suffering or hardship to my family. And we shouldn't make we shouldn't force people into these conditions. We need to improve on the availability of treatment and most importantly, protect people from that financial burden or catastrophe that I mentioned. So, what we want to see in the report findings also is increase in patient voice. Whatever treatment needs to be patient-centered. It needs to ensure that whatever solution that comes out, it's not taking care of the health system. Of course, the health system reality, they'll look at how much can we afford, how much can we not afford, and so forth. But here's the thing, when it comes to a condition like psoriasis, patients must have a voice in the treatment that they're being the beneficiaries for. They cannot be passive recipients. They must be active. It needs to be centered around patient outcomes to ensure that people who need the treatment get the treatment that they need. But most importantly, we are not prescribing it for them. We're basically listening to what they need and responding to what they need. And that's how we should design treatment plans for patients rather than, I'm sorry, we can't really afford this treatment for you, so we'll give you a suboptimal one. And then you expect the person to be happy because you received a suboptimal, and then you expect the same result as if you had an optimal treatment plan. So these things we need to be able to address, especially within the context of providing treatment for people living with psoriasis, because it's not a short-term period. It's a commitment. If you talk about providing treatment for a group of people, it's not just for 2 weeks, 3 weeks. It could be over a lifetime.
Sure.
And so we need to be able to manage that, and we need to also understand what those needs are.
Right. Thank you, Encik Azrul. The Malaysian Psoriasis Registry was established in 1998 to provide real-world insights into clinical practice, describe patient outcomes, and measure quality of care. I invite Dr. Suganthy to give us some insights on the findings of the registry most recent report.
Thank you, Sophia. The key findings from the Malaysian Psoriasis Registry Report 2007 to 2019 stated that moderate to severe psoriasis patients in Malaysia were at a higher risk for various cardiovascular comorbidities when compared with the general population. Very few patients with moderate to severe psoriasis receive biologics, especially in comparison with other countries. We are 1.72% compared to 9.2% in the UK and 14% in the US, suggesting that there is a potential treatment gap in this group of patients whose more severe disease may warrant more efficacious treatment in order to modify the cause of the disease.
Thank you to all our speakers for the invaluable sharing. These findings underscore the urgent need for improved access to funding for psoriatic patients in this country, as well as the need to classify psoriasis and psoriatic arthritis as critical illness under both public and private healthcare insurance schemes. The continued failure to address these funding and regulatory issues has resulted in a lower proportion of Malaysian patients, approximately 14% receiving the latest treatment, compared to their counterparts in Korea, 37%, and Hong Kong, 55%. We hope this situation will improve with the recent announcement on the proposed National Health Financing Scheme. For more information, please reach out to Psoriasis Association of Malaysia, and you can also reach out to them via Facebook and Instagram. Thank you for joining us on this episode, Beyond the Surface, a Psoriasis podcast. And make sure don't miss the next episode. Thank you and see you soon. Bye.